Bismillah ar-Rahman ar-Rahim. This is part 2 in our scheme to identify histological slides for the second year. The first subgroup in this video is the organs covered by stratified squamous epithelium. These organs are of two subcategories. First, the muscular organs covered by stratified squamous and non-muscular covered by stratified squamous in the form of skin only. As regards the muscular organs, we have two categories: those covered by skin from one side and mucous membrane from the other side, and these include the lip and the eyelid. And the muscular organs which are covered by mucous membrane only, we have tongue of human and tongue of rabbit. So, as regards the muscular organs covered by stratified squamous, we have lip, eyelid, tongue of human, and tongue of rabbit. Then we have organs covered by skin only, and they are not muscular. They are not showing a definite muscle layer. These are the penis and the lactating mammary gland. So in this group, we have 6 slides. The first slide in this group is the lip, which is covered from both surfaces by stratified squamous epithelium. One surface is the skin and the other is a mucous membrane. How to know the slide of the lip? It is U-shaped, and it is formed of a bulk of muscle at different directions. And then look at the side of the mucous membrane. You will notice these labial mucous glands, which are pale blue. Sorry. And also look at the margin, which will be devoid of hair follicles. Then you can see now this picture. Here you can see that this is the margin devoid of hair follicles. This is the bulk of the muscle. Now, this is the margin, this is the bulk of the muscle, and this is the mucous pale blue glands, and here we have the skin side. Then we have another picture. Here you can see the pale blue mucous glands towards the mucous membrane side. How they are present in this bandular form. Also, this is the skin side of the lip with the hair follicles. And this is the margin here. This is the margin devoid of the hair follicles, and you can see here the muscle layer. And also look at the mucous membrane here, and these are the glands. Take care that sometimes the glands are not properly stained, so you should carefully examine the section to find out that they are pale blue glands, vacuolated, and present towards the mucous membrane side. And also, you will notice the absence of the hair follicles at the margin and the typical U-shaped structure. Here, this is the second slide in the group of muscular organs covered by stratified squamous on both sides. We have here the eyelid, which is also U-shaped, but it is more pointed, and it has the skin from one side, the mucous membrane from the other side, and Towards the mucous membrane, you will notice the meibomian glands, which are sebaceous glands. Also, sometimes, not always, you will see a hair follicle of the eyelash at the margin. Now, let us see these structures. Here, this is the picture under the low power. You can see that these are the meibomian gland, looking like a tree, or sometimes they are present in the form of sections separate from each other, and they have a duct that opens at the margin. And this is the muscle tissue. This is, of course, the thin skin, and these are the lashes, and this is the mucous membrane side. Now, let's take this picture. This is the mucous membrane side, the skin side, I'm sorry. This is the skin side, and here we have the hair follicles, and related to the skin side, we have the muscle. And this is a very nice picture also for the eyelid. You can notice the skin side is the upper one, and this is the mucous membrane, the meibomian glands here appearing as the vacuolated cells, but each cell has some dots like this. We have dots inside the cells representing the nuclei of the mother cells that will form the sebum. Here, not necessary to find the duct opening into the margin, and also towards the margin here we have one or two rows of the lashes. These are the hair follicles of the lashes, and of course this is the muscle. Again, we have another picture also. This one here, it demonstrates very nice meibomian glands towards the mucous membrane side, and they are vacuolated. And if you look carefully, you will notice that these cells towards the base have these nuclei and not nucleated towards the center. I'm trying to differentiate between these glands and the mucous labial glands in the lip, because it is a very important clue to differentiate between them. Also, the muscle here are almost in one direction, but in the lip they are in different directions. Here we have another organ which is muscular but not covered by skin. It is covered by stratified squamous epithelium in the form of mucous membrane. And the upper surface here is forming these papillae, and the lower does not form papillae. In between, we have a big bulk of the muscle. Notice here, this is also the dorsum of the human tongue, and it shows these papillae and a big bulk of muscle at different directions, as you see. And then you will move the slide also to show the undersurface. Here it is formed of this smooth surface of mucous membrane, and these are the papillae, of course, filiform papillae, fungiform papillae, and these are the muscle tissue. Again, also we have another picture. All of these pictures demonstrate the appearance of the papillae, the filiform and fungiform papillae, and the muscle tissue. Another picture also, all from your slides. Here, this is also the appearance of the papillae over the muscle tissue. So, this slide is characterized by being here like a triangle, and it is pointed, and one surface shows the papillae and the other is smooth, and the muscle, big bulk of muscle in between can be seen. Of course, this is tongue of human. Then we have the tongue of rabbit that you have to differentiate between it and the tongue of human. The most important thing, this tongue of rabbit appears as a bulk of muscle and covered on one surface by this mucous membrane. And this mucous membrane, if you look carefully, it shows at least at part of it these rectangles of papilla foliata, and each one has these two epithelial ridges alternating with the papillae of connective tissue, looking like the figure of the number 11. And here we have the muscle at different directions. Take care that they may be present at only a certain part, not all the parts of the dorsum of the tongue. And here you can see that we have, you have deep in the muscle, you have these glands present deep in the muscle. So this is tongue of rabbit or papilla foliata. These are serous glands present in the substance of the tongue of rabbit. Belonging to the group of the structures covered by stratified squamous in the form of skin, we have two organs, the penis and the lactating mammary gland. The penis here is formed of two corpora cavernosa and corpus spongiosum, characterized by the presence of the penile urethra, which is having a very characteristic folded of the mucosa. And the skin is present on the surface. But this is the naked eye picture. Now, under the microscope, you will not see all of the organ. You will see this is the skin on the surface here. I will make it more magnified. This is the skin of the covering of the penis, and this is one of the corpora cavernosa, and this is of course the corpus spongiosum with the characteristic folding of the epithelium of the penile urethra. And of course this is the surrounding tunica albuginea, fibrous connective tissue, which is very thick around each of the corpora cavernosa and thin around the corpus spongiosum. Again, another picture here will show also the skin here and the corpus spongiosum and the corpus cavernosum. You cannot see all of the corpora or all of the structure under the microscope in a one field. Again, here we have, this is the picture showing the corpus spongiosum with the penile urethra, and this is part of corpus cavernosum, and this is the other part, and I cannot see the skin in the same field of view. The other slide in the organs covered by skin is the mammary gland, which is a lactating mammary gland, and you will notice that it is a part from the mammary gland only, just a sector, and the skin is very characteristic on the surface, on one surface, and not surrounding the whole structure. And this is the dermis of the skin showing glands here, and then we have the lobules of the mammary gland containing the acini that are filled with the pink or red secretion, which is the milk. This is the general architecture of the slide. Now look at the slide itself. Now we have here the skin, keratinous stratified squamous epithelium, and here we have hair follicles. Here we have glands present in the dermis of this skin with many fat cells. All of this is the skin covering, and then we will see a lobule of the breast, and the acini are filled with this red or pink secretion, which is the milk secretion. Another group in the scheme of identification of the slides, the elongated structures. This group includes 6 organs. What are these 6 organs? We have fundus of the stomach and the pylorus. We have the gastroesophageal and the pyloroduodenal. We have thick skin and thin skin. Actually, each two are closely related to each other. Starting with the fundus is characterized by having a folded mucosa. and then a pale area of the submucosa, then the musculosa. Folded mucosa, submucosa, and the musculosa. By looking at the slide here, you will notice that it has the pits about 1/3 of the mucosa or 1/4 of the mucosa, and the folds are very evident. This is the muscularis mucosa, submucosa, and the muscle. Again, in this slide, you will notice that the same features. We have the narrow pits, which are the ducts of the glands, and they are forming 1/4 or 1/3 of the mucosa, which is highly folded, and then the submucosa and the muscle. With more magnification here, you can see under the microscope, we will see what I mean, which is the appearance of a folded mucosa, and the glands are highly crowded. The pits are 1/4 of the thickness of the mucosa itself. Each slide will have the same feature. Also here we have these pits, 1/4 of the thickness. Pits are evident tubes here with a lumen, white lumen, and they are very crowded, and it is a folded mucosa. Again, we have another picture. All the pictures have the same feature. The pits, the crowded, the folding, these are the features for the fundus. When we move to the pylorus, the mucosa itself is not so folded like that of the fundus. You may see some slight folding, very slight folding, not vigorous folding, not a fold taking with it the connective tissue with the submucosa. Here the mucosa more or less is straight, and if you look to the pits, which are white in color, almost half of the thickness, and some of the deep part of the glands appear as mucus acini. So these are very important features to differentiate between the fundus and the pylorus. Here the submucosa and the musculosa. Again, we will see the other picture here in more details. Here you will notice, this is a picture of your slide under the microscope. You will notice what I have said as regards the straight. The list number can be seen individually, the ratio between the pit and the mucosa, and the appearance of these mucus acini, which are transversely cut deep part of the glands. So this is the pylorus. Come to the next subgroup, which are the junctions. The junctions are very long in length, and we have two junctions only. We have the gastroesophageal and pyloroduodenal. This is the gastroesophageal. How can I know it? If you look to this slide here, you will notice that at one side you have this epithelium, which is the stratified squamous, has no striations, has no white spaces inside. These are a compact epithelium, no glands in this epithelium. But in case of the other side, you have these irregularities of white striations can be seen. So whenever you see at one side a stratified squamous epithelium, which is compact, and on the other side we have these white striations, this is the gastroesophageal junction. To make more sure judgment, look at the mucus acini under this stratified squamous epithelium. These are the mucus glands of the esophagus, which are present in esophagus of dog. And then we have the muscle with more enlargement of the muscle towards the stomach. So first of all, look at the whole epithelium. If you find at one side this stratified squamous, which is not having any white striations, this is the esophagus, and then on the other side you will see these white striations, which are the openings of the glands and the glands themselves. So this is the gastroesophageal junction. Now try to also enlarge this picture. At one side you will see the stratified squamous, compact, and on the other side we have this lumina. And towards the esophagus you will have the mucus glands with their ducts passing to open here. So this is the gastroesophageal junction. In case of pyloroduodenal junction, the condition is different. You will notice that you will search for the whole epithelium, and you will notice that all through the epithelium you have these white striations denoting the ducts of the glands, and on the other side is the same. This second muscle represents the area of the pylorus, and this is the area of the duodenum where you can see the Brunner's glands. So all through I have these openings, these ducts. Okay, so here we have villi and crypts actually, and here we have the pits, but as a first look, all the epithelium is showing these white striations, and at one side you will see the mucus glands of the Brunner's, and the other you will see the muscle of the pyloric sphincter. No stratified squamous epithelium all over this epithelium, so this is the pyloroduodenal junction. Now try to see the other picture. Here, the same feature. All through you have these white striations. This is the area of the pylorus because I have this pyloric sphincter, and this is the area of the duodenum because I have the Brunner's gland. So these are villi and crypts. Villi and crypts. So I have these spaces. It is seen as striations here and striations there for the pits. So this is the pyloroduodenal junction. The last two slides in the group of elongated structures is the skin. Of course, you know that we have the thick skin and the thin skin. Here in the thick skin, it is characterized by having a thick keratin, which is pink in color, either this or that. If you look to the epidermis here is compact with no hair follicles opening in it. Here you are seeing the dermis, and you may not always see these Pacinian corpuscles. Now I will make it more large to see actually the Pacinian corpuscles. So we have a very thick keratin layer. We have the epidermis not pierced by the hair follicles, and this is not the appearance of Pacinian is not a mandatory feature to be seen in the slide. Actually, this slide, as it is taken from the tip of the finger, it is slightly curved. It is slightly curved. Here we have the thin skin. In case of the thin skin, you will notice that the keratin is very thin, and we will search for the whole epithelium. You will see this opening of the hair follicle. Sometimes you cannot see these openings, and you will see the hair follicles deep here in the dermis, and most probably they have a yellow coloration inside of the follicle, denoting the pigmented part of the hair itself. And also we have here sebaceous glands. Here we have sebaceous glands related to the hair follicle. Now let's see other pictures. This is the picture also of the thick skin. You will search whole epithelium. You will notice that it is not pierced by any hair follicles all through, but in this slide here you will see the thin keratin Here, this is on the other side. Here we have a thick keratin, and it is not pierced by hair follicles, but here you will see that the thin keratin here is evident, and there is a hair follicle with a sebaceous gland. Now I will make it here. These are the sebaceous gland, which appear to have some dots inside, and they have evacuated contents due to the dissolving of the sebum. These are the sebaceous glands surrounding the hair follicle. So this is the thick skin on the right side, and this is the thin skin. In this presentation, we have taken 12 slides. We have taken the elongated structures, which contains 6 slides: fundus, pylorus, gastroesophageal, pyloroduodenal, thick and thin skin. We have taken the organs covered by stratified squamous, covered by skin and mucous membrane, lip and eyelid, covered by mucous membrane only, human and rabbit tongue. Non-muscular, covered by skin only, penis and lactating mammary glands. Best wishes for all of you.